Greetings. My name is Micheline Ishay. I'm a professor of international study and human rights at the Colbert School of International Studies at the University of Denver. I'm also an associate director of the International Council for Diplomacy and Dialogue. It's my really great pleasure to greet for this conversation Alfredo Morabia. Really, thank you for being with us. So
Thanks for having me, Micheline.
Yes, wonderful. So who are we? We are the International Council for Diplomacy and Dialogue, ICDD, which have been formed to engage in advocacy of conflict and resolution. Our organization is committed to facilitating negotiation between political rivals, serving as an unofficial conduit where official contact is impossible, and participating in international forums. We are already collaborating with a number of NGOs. For instance, la coordination des associations et des particuliers de la liberté de conscience, freedom of consciousness, Humanity Without Frontiers, and other humanitarian networks. ICDD has also been in contact with the Yazidis, Yemeni exiles, and representatives of Bahrain, Guinea, and other states in the Middle East, as well as UNESCO and the European Union. ICDD express really no particular orthodoxy, and it's really deeply committed to human rights, social justice, economic equality, and the environment. Our associates and members are personality from different training and perspectives, and we are located really in different parts of the world. Currently, we are focusing on the impact of population impacted by COVID-19 in a series we call The Crisis. So Alfredo Morabia will talk about the pandemics and public health, the past, present, and if he will indulge me, also the future. So just a few words about Alfredo Morabia. He has this impressive CV, and I strongly recommend all of you to check it out. But I'm gonna just briefly mention a few things about it. He's a board certified in both internal medicine and occupational medicine from the University of Geneva. He has a PhD in epidemiology from Johns Hopkins School of Hygiene and Public Health. He's currently professor of clinical epidemiology at the Mailman School of Public Health at Columbia University in New York City, and professor of epidemiology at the Barry Commoner Center for Health and the Environment at Queens College, City University, also of New York. His domain of research are urban health and history, and Dr. Morabia lectures and teaches on a history of epidemiology internationally in a variety of languages, in English, French, Spanish, Portuguese, and Italian. And I'm so glad we are settling on English, Alfredo, because we could just probably have an interesting conversation in other languages. Alfredo Morabia also served as the editor-in-chief of the very prestigious American Journal of Public Health, and he's also the editor of epidemiology in history at the American Journal of Epidemiology. His recent book, Enigmas of Health and Disease, How Epidemiology Contributes to Unravel Scientific Mystery, was published by Columbia University. And I have to say, I've just read it recently, Alfredo, and I think it's just a fantastic book, strongly recommended, given what we are experiencing in our day. So let me just go back to your training. You are both a medical doctor, you're an historian, you're an epidemiologist. So what I would like to do is to divide this conversation in three parts. One, the past, the present, and the future of pandemic and public health. So Alfredo, just let me start with this question. And I know you discuss about it in your work and your research, and it's really, really interesting. What can we really learn historically from previous pandemics that can help us in some way address COVID-19?
Or maybe the most important lesson is that they pass. They go away.
They certainly pass, but beyond that, they passed. But what do we learn, and how could this one pass even faster? What do you think that is central to our understanding in public health with respect to the pandemic? The Black plague fostered, for instance, and I read it in your book, scientific innovations during the Enlightenment. So what do you think we will see, and what do we learn from all past pandemics since the 17th century to the present that you think is worth retaining our consideration?
Yeah, and I think we look today at those pandemic with a very different eyes. You know, it used to be something very distant to talk about the Black Death or the cholera epidemic, or the pandemic of flu in 1918. But now when we look at them again, it's with a sense of better understanding, because we've been through those very difficult weeks and months that just passed. So one thing that is crucial, I think, for the main pandemics that we've known, and I think the main ones are the Black Death, the epidemic of plague, which was recurrent, but in the 17th century, that was the last century of that specific pandemic. So this is one. The cholera epidemic of the 19th century was probably the most frightful of all of them. Then there's been the influenza of the 1918. I would say tuberculosis at the beginning of the 20th century has to be seen as another form of pandemic for the type of scare that it generated. And we've had the HIV/AIDS epidemic of the 1980s. All those were pandemic, they were frightful. People were surrounded by deaths in a very unusual way, and they brought a sense of urgency, to change things. It's because a pandemic is a kind of failure of society against nature. All of a sudden, we're overwhelmed by this phenomenon, and all our means, all our tools, or our scientific tools seems to be useless. And so there is an urgency to change. And I think there have been major scientific changes after each of those pandemics, but there's been also major societal changes. Maybe we're looking, backward, and retrospectively, we're kind of associating things that should not be associated, but the regularity of the change in societal and scientific following those major pandemics, which we don't see for minor pandemics, is striking. And I think it's probably real.
So in a way, can you say that we are better prepared today to face a pandemic than at other times, say during the 1918 Spanish flu? And if so, are there always ways in which we're also more vulnerable?
Yeah, sure. I mean, of course, we are better prepared. Of course. I mean, let's compare 1918 to today. In 1918, they didn't know what was the cause of the pandemic. They didn't know which virus it was, which type of microorganism it was. They didn't have an idea of exactly how to reduce its transmission. They couldn't measure it otherwise than, through interviews. They didn't have serology. Today, in a few weeks, we know what type of virus it is. We have all the biological details of this disease. We can follow it, we can track it. We are much better off in some ways than we were in 1918. The problem that I see is that we are not much better off today than in 1918 in terms of the role of public health and the role of medicine. This is really striking, that the lessons over the last century haven't been drawn, and the place of public health, which is the only thing that works today, is still totally under-evaluated in our society. I mean, 3% of the budget that goes for health in the United States for public health. And when we see the response to COVID, the only thing that worked, besides the biology and the description of the virus are public health means. There's no treatment. We're waiting for a vaccine, which is also a public health mean. But otherwise, it's all about personal protection, social distancing, and this thing. And so it's really a moment in which public health could have been playing a major role and is not playing that role.
So here's an interesting paradox. So since the 1918, we have certainly more vaccines, more knowledge about diseases. And at the same time, with growing access to transportation, density in urban centers, viruses are spreading faster than ever before. Which of these two trends do you think are going to be taking over?
Yeah, but in the 1918, one of the major means of propagation of the pandemic was the movement of troops from the United States to Europe and back. I mean, there was a lot of movement. Maybe it was a little bit slower, but concentrations were very high. And people were not really aware on how to prevent the transmission. So I don't think that's really an issue. I think we have everything we need to control this this pandemic. We knew it would come. We knew exactly how it would come, with some few details. In October 2018, American Journal of Public Health had a whole dossier on that where everything was described, but people didn't want to take it into consideration. In some ways, we are here, how many weeks, months into this pandemic? We don't know. We still don't know how many people have been infected and how many people have died of it. And it's really basic surveillance that is still lacking and is still wanting. And without that, it's like moving blindly through this pandemic.
So it's interesting, you're talking about surveillance, which brings me to another considerations, because we know we have pre-COVID-19 been in the periods of populist and nationalist era, which is really thriving on imprecision and disinformations. So do you think that pandemic is really strengthening the power of leaders, nationalist and populist leaders that have spread and that have been elected in the past 5 years or so?
I don't think we can say whether it strengthens them or it weakens them. I mean, we'll see. I think movements are going in both directions, and maybe more in discrediting this government than anything else, because the burden on the population is extremely high, and I think people are just exhausted and rejecting the incompetency of the various governments that have addressed this pandemic. But on the other hand, the level of, I would say, disinformation, active disinformation, has been helping to grow the confusion about this, the reaction and the response to the pandemic. That's a real problem. And there are so many voices and I mean, it's more than voices. It's an industrial endeavor to generate false ideas, fake news, to generate confusion. The journal, the American Journal of Public Health, we've published a research 2 years ago showing that those bots and trolls that are active on social media, I mean, they are produced like industrially. And they are not only produced in order to support one opinion, but they are produced to support both opinion and to generate confusion. And so on social media posts that are more seen by conservative people, they say, well, those Democrats, they want all our kids to get vaccinated so that they get sick, etc. On the more progressive social media, the same the same producer of this information was saying the opposite. Well, those Republicans, they don't want to vaccinate their children because they want our kids, you know, to get sick, etc. So that's again, it's a very large scale phenomenon, not by individual, but by groups of people. And this has clearly contributed to the disorganization of the response to COVID.
It's interesting when you mentioned surveillance. I was thinking that to track the disease, more surveillance would have been beneficial, but at the same time, populist leaders have not used it to the extent, particularly in this country, as we would have expected. In fact, they went the other way around. How do you
But we don't have the data. We don't know. We don't have the surveillance. I mean, currently we have data on testing and deaths attributed to COVID, but those are highly selective. They are meaningless. I mean, there have been thousands of articles published with those data. They are going to be all trashed because there is nothing that is representative of what's going on in the population. So who gets tested? People who are at very high risk, people who have symptoms, and the people that have no symptoms are at very low risk. They have no reason to get tested. What is needed are random sample of the population that give us a real picture of what's going on. And there's only one place in the world, again, Spain, and it used to be the Spanish influenza because Spain was generating all the right data in 1918, 1919. They were out of the war for different reasons, but the data about the pandemic came from Spain. And today, the only study that is based on a random sample of 50,000 people is in Spain. And what it shows is that in this country, which was highly hit by the pandemic, was a hotspot of the pandemic, today, only 5% of the population has been infected, is seropositive. And in a place like Madrid, it's 11%.
It's very interesting.
It also shows us something very unique, that there is about 1/3 of the population that is seropositive but have no symptoms.
This is interesting. As you talk about random survey, you discuss, I'm just going to go to this part of your book and your research, you discuss the social and economic factors that are affecting the impact of disease. And so when we randomize or survey, obviously we want to make sure that we have that sample of the population in mind, because in a way, why are certain populations within the US and elsewhere also seemingly more vulnerable to COVID-19? And how do you think we should address this problem?
Well, you see, COVID-19 just didn't come out of nothing, It just hit a society which had all its contradiction, all its problem, and with respect to public health. And the things that were most favorable for the development of the pandemic was, first of all, the huge inequalities that exist. And so people that have no access to services, that when they lose their job have absolutely no income and no health insurance, people that live in crowded housing, etc. I mean, all those inequality favor, the dissemination and the transmission of the disease, and hit the population that were already vulnerable, made them even more vulnerable. So this is a structural phenomenon. The second structural phenomenon is chronic diseases. Before COVID, we've had, this epidemic of obesity, diabetes, heart diseases, etc., which are also, favoring factors to have severe consequences, complication of the infection. And we have this incredible healthcare system, which leaves out about 30 million people today and maybe more tomorrow. So all these were the underlying structural condition in which this pandemic thrived. If these issues were addressed, we would never be in the situation we are today.
So,
Yeah, please.
no, just a follow up. So, are we in a worse situation that said, let's say in the 1970s, where we seem to be in a hiatus, where some form of recess and respite with respect to pandemic, polio, and smallpox has been eradicated or soon to be eradicated, and then people were sort of in that moment of bliss that they were over the pandemic. Do you think that we have gone backwards since that period? What's your view on
Well,
that?
the period that you talk about in which we thought infectious diseases were, controlled and we wouldn't have to deal with them at a very large scale anymore, it was very short. It was in the 70s. But already in 1981, 82, you have the beginning of the HIV/AIDS pandemic. And this brought back infectious diseases to the front and put in jeopardy all our approaches scientifically, and even from a public health perspective of how we dealt with what had become epidemics of chronic disease, like cancer, like cardiovascular disease. All of a sudden we had infectious disease here again, and we had to reinvent, at least epidemiology, a great deal of it.
Yes, I just want to just bring you back to some of the public policy questions that are very much in the minds of people today. There is a wide debate in this country and beyond as just simply as whether schools should be reopened. What are your views on this issue? Where should we go, given the uncertainty of that particular pandemic? Does it make sense to reopen in September our schools? And I'm talking about elementary, high school, and university.
So that's a tricky question, because it doesn't have a simple answer, yes, no. This is not the question. The question is, how can we reopen school in a very careful way? I mean, to limit the consequences of, potentially feeding the pandemic and bringing us in another wave, very severe one. I mean, that's the question. What can we do? And we know we can do things. There's no reason why we could not reopen school if the means are given, if people can be tested when they need, if we have random testing so we know where we are in the progression of the epidemic, if the schools are given the means to have received the children, to have the social distancing, if the parents have broadband internet, because if part of it will remain online and you don't have broadband internet, it's just, means nothing. So the question is, are we going to invest in terms of public health and in terms of resources, for the schools and for the parents in order to make this happen? That's the question.
That's a very important information for governors who seem to just sort of dismiss the importance of the means and the capacities of school to actually really entertain online if needed be with just a spike in the virus. For children and others, we saw that the pandemic has major mental health consequences. I know you've written about that also. And I was wondering if you could sort of entertain for us, what is the impact of this pandemic, in light of other knowledge, informations of the history, for mental health, and what can we do about it?
Well, we don't know much yet because we don't have much data. That's one of the big problem and failure of those first 6 months, is that we haven't been able to trace all that. The only thing we can say is that we know social isolation is a big problem, that mental health problems are a major problem, that they can always flare up, and that this epidemic has created the condition for a new outbreaks, I would say, of those types of different types of mental health problems. And so we already had, just before the pandemic, we already had this epidemic of deaths of despair. You know, we had people dying from suicide, violence, that from addiction and overdoses. So these things haven't disappeared, but they are exacerbated by the response that has been given to the pandemic, which is confused, disorganized, doesn't take into consideration the need of population that have been made vulnerable by decades of economic neglect, economic decline, etc. I mean, that's the problem. We know the field, you know, is ripe for an explosion of these issues, and this again is largely due to the fact that we came into this non-prepared where we could have been prepared.
So in thinking about those preparations, there must be something also cultural in this country when Americans say, my freedom is encroached if I cannot choose whether I want to wear a mask or not. That's sort of basically stemmed from a very more individualistic way of thinking. Do not tell me what to do. Do you think that it's endemic to the United States? Is it the same in other, comparatively speaking, with other countries in Europe where you see a different way of connecting and understanding the severity of COVID-19?
I think it's a caricature. I think this doesn't exist. I think the issue of liberty and freedom is used when people want it, and so according to the context, you know, people are going to raise it when they are conservative, and in other contexts when they are progressive. It depends what the topic is about and who it's, you know, it's convenient for. But otherwise, I think it's a caricature. People's psychology, you know, is the same throughout the world. I don't think Americans are very different from Europeans or other from that perspective. And people understand what their health means and how they want to be protected. And I would tell you that I'm quite convinced that the large majority of people in this country and in other countries want to be protected first.
So let me just ask you questions about the future and perhaps methodology about prediction. I understand public health is very much attempting to prevent disease and also to forecast disease in order to prevent them. So can we consider the pandemic as a black swan effect? And here, of course, I use the name of Taleb's book, The Black Swan, namely that event is an outlier, that it has a significant impact, but it also retrospectively, it was predictable. Can we ever predict ahead of time? And to what extent the next pandemic, particularly when we did not have a pandemic of that sort in the past? Because what do you think? Because people can always say, I said so, but there are always people who say, I say so, it doesn't happen. There are a lot of unsung heroes. Could we really predict? You said yes before, but I just want to push you on this question.
No, but you see, Micheline, there have been many other situations like that in the past. So we know that these things are going to happen again. I mean, there's absolutely no doubt about it. The only thing we don't know when. But the question is, what can we do to be better prepared? And there is one major thing that would change everything in the future, is to reevaluate the place to reassess the place of public health in our health system, in general. Currently, it's, as I told you, the budget going to public health is extremely small and it's been going down since 2008. And we've been losing public health workforce. I mean, everything that goes in the wrong direction. And what we see today is that the only thing, and I know I'm repeating myself, but it's a very striking observation, that the only things that work are public health interventions. And we know about, intervening and communicating about social distancing, about personal protection, doing contact tracing, preparing the field for a vaccine, because having the vaccine is something, but having people taking the vaccine is another story. I mean, all these issues which are crucial, which explain the situation when a state did well and went over this pandemic, whereas in other states they didn't. I mean, it's all public health. And the reassessing its role, increasing its role, having a better integration with the healthcare is key. And the problem, and I'm going to insist on that, is that public health cannot be done by people who don't have the expertise in public health, because public health is dealing with populations. And you cannot understand how population behaves, how to compare population, how to monitor population, if you haven't been trained for, or if you haven't analyzed data yourself. There's nothing in the growth of our psychology or intelligence that allows us to understand that there is a universe in which is comprised by populations and not individuals. And so as long as you don't have people who understand population thinking and all think only in terms of individuals, we cannot progress. And all the medical care, the clinical care, etc., is oriented towards the individual. But a pandemic is a population phenomenon, and it's controlled at the population level. So I think training in public health, bringing the public health people at the decision level, in the government, giving them, the opportunity to give their opinion and to lead the response, which was the case in 1918. In 1918, the Public Health Service, Robert Blue was the Surgeon General, Wade Hampton Frost was the leader of the task force, first professor of epidemiology in the United States at Johns Hopkins. That was the case in 1918-19. That's not the case today. So I think the major potential change that may occur tomorrow as a consequence of this pandemic is a reevaluation, reassessment, a revalorization of the role of public health, of the workforce in public health, and its role at the federal, at the state, and at the local level.
So medicine has been over-specialized in a way, and epidemiology provided bigger pictures of disease and preventions of disease. In a way, you are calling for more training in that particular expertise, sort of epidemiology and public health. And at the same time, I think that in your book, you mentioned something that was interesting, the importance of studying epidemiology in high schools and how to educate people in this field, which we are seeing today a lack of literacy to the consequences, the impact of the pandemic. So how you would go about that?
That's population thinking, and it's the most important component of epidemiology. Again, it's to learn how to think in terms of populations and not of individual. And it's, again, something that you cannot acquire spontaneously. How intelligent you are is not the issue. People haven't been, didn't know that it existed until the 18th century, the 17th century. Because it's only then that we had enough data to analyze and to observe that populations were predictable, that they were comparable, everything that doesn't exist at the individual level. So because this is something that you must acquire, that you cannot, just get spontaneously or through your individual psychological growth, you need to be taught. And the best moment to do it is in high school, because students then acquire a lot of knowledge in physics and chemistry, etc. And this should be part of the basic knowledge that they should get. How do we interpret population data? When I say, the risk of dying from COVID-19 among people infected is 2%. What does it mean for me? 2%. And so this is population thinking. The being able to understand these things for a population of 100 people that would be infected and others that would not be infected is something that you must acquire. And once you're an adult, it becomes very difficult if you don't go through specific schools, etc. But my feeling is that when you're a teenager, and we could discuss things like marijuana or sexual behaviors, things that are of interest, or the opioid epidemic or vaping, etc. We could approach all these questions, which are important for teenagers, from a population-based perspective and make them understand how to think about those things in terms of population. I think that would be would make a tremendous differences in the place and the understanding of the role of public health in our societies.
So in summary, what you're saying, we need to fund more public health, we need to train more people in public health, and we need to integrate it in the public school education. More specifically, I want to ask you, and perhaps focusing on your field, the following. So we have learned from previous pandemic, but did we improve our methods of preventing diseases? Did our public health method change? And would they change for the future in light of what we have experienced? And if so, how so? What's your take on that?
So I think in some ways the answer is positive, is yes. We've learned a lot from previous pandemics, and we know how to prepare ourselves. It's quite established, but the problem is that this knowledge has not been translated into major governmental and behavior and policies. That's the problem. We haven't integrated the importance of public health in our response at the governmental level, at all the levels of our society in which it should be present. In some ways, I tell you, I think in 1918, 1919, that was the duration of this grand influenza, there were aspects that were more advanced than today. For example, in the fall of 1918, the Public Health Service started a large random survey of 140,000 people in 18 different localities of the United States to assess the prevalence of people having had symptoms, because at that time, that's the only thing they could do, They didn't have serology and things like that, but they could interview households about how many cases there were, when did they start, when did they end, etc. And so they launched this huge survey, 140,000 people in 1918. It was house-to-house canvassing to get an exact idea of the progression of the epidemic in the population. We don't have this today. We still don't have this today in the United States, where we could do this in a much more, easy way than it was the case 100 years ago. So, the progress is not as obvious when you look at practice, but it's clear when you look at theory.
Well, very interesting to know that the 1918s, the house-to-house canvassing was sort of, in a way, ahead of us, and in a way, it should be a place to inform perhaps not this current administrations, but future ones, because I think that it's a valuable lessons from history. I want to thank you, Alfredo Morabia, for this really interesting conversations. And for those of us who are watching us, I want to remind you that he has written an excellent book, really easy to read for the lay person like myself and others. It's called Enigma of Health and Disease, How Epidemiology Contributes to Unravel Scientific Mystery. I know that you're also the chief editor of the American Journal of Public Health, and so I want to just bring our viewers to the attentions of the journals, and the issues are of a great interest, particularly nowadays, for what's happening. And so more information is needed. Here's one place we could get it. So once again, Alfredo, thank you so much for being with us and for taking the time.
Thank you, Micheline. It's been a pleasure, and thank you for all those great questions. Appreciate it.